Here we are at EHA 19 in Milan, and we're going to have today, which is Friday 11:30, we're going to have a lunch debate on CLL and in essence on the value of prognostic markers at the time when prognostication has become so relevant and maybe widely diffused in CLL. And the two contenders are going to be Gianluca Gaidano and Kostas Novadopoulou. Very important. And I would like them to briefly say in a couple of minutes what they're going to do. Who wants to start? It's going to be a yes and no. Kostas, you start for the yes.
So I took the yes part, and will be yes, because we have already moved in an era of biological treatment in CLL, and we need biomarkers to understand the disease, but speaking of prognosis, to help us decide about how to follow up and how to manage patients. There is exciting times. We have learned a lot. We have new biological treatments, and we need to incorporate knowledge from the biology of the disease with knowledge from the clinical applications of the new biological agents in order to improve the overall management and perhaps attain cure for patients with this still incurable disease.
So Kostas is very much for the yes, and now we'll hear a less positive, maybe a bit more uncertain view, but this is a debate. And the two are really in favor of yes, but this is a bit artificial. So, Gianluca, how would you defend the little less favorable side of prognostication?
With the new studies with next generation sequences, we developed so many biomarkers that perhaps there are more biomarkers than CLL physicians. So then at a certain point you want to make a choice. And I think we should go for biomarkers that are true predictors of treatment, choice of therapy, of response, and of overall survival. So not all of them are true predictors. Many are simply prognosticators. So I think that in a time of crisis, we really have to spend our money for diagnosis very well. And so I will defend P53, obviously, which is a true predictor, even in the era of the new drugs, and a few other ones. So I would be rather conservative in a way.
Fine, thank you very much. It will be a very lively discussion, and if something more comes out, we'll have another interview to summarize what you said.